Hello and welcome to the Mental Health Services Act and Butte County presentation. This presentation serves to provide the viewer with a basic introduction to the Mental Health Services Act, also known as MHSA. You will learn how the Act came to be, its guiding principles, its funding characteristics, and how Butte County implements the Act on a local level. November of 2004, California voters passed Proposition 63, creating the Mental Health Services Act. This act produced an additional 1% tax on any California resident making more than $1 million in order to enhance the system of care for mental health services. The need for an enhanced system of care was born out of community and stakeholders urging for systemic change. Prop 63 was a legislative movement to provide better coordinated and more comprehensive care to those with mental illness with a focus on underserved populations. The MHSA is also unique as its purpose includes reducing the impact of untreated mental illness on individuals, families, and state and local budgets. Approximately 0.1% of taxpayers are impacted by this tax, but since its inception, it has generated approximately $14 billion statewide. The passing of Prop 63 provided the first opportunity in many years to expand county mental health programs for all populations and age groups. Children 0 to 15 years old, transition age youth 16 to 25 years old, adults 26 to 59, and older adults 60 years and older. Programming also focuses on families and especially the unserved and/or underserved populations. These guiding principles should be included in all areas of MHSA, and programming should be designed to implement the core values of community collaboration, cultural competence, services that are client-driven by adults and family-driven for youth. All services must be focused on wellness, recovery, and resiliency, and MHSA programming should provide an integrated service experience. Each year, MHSA revenue from taxes is collected, and before it's allocated to counties, 5% is allocated to statewide administrative and oversight of the MHSA. Funds are then distributed to counties on a monthly basis by utilizing a formula that considers many factors, such as population, poverty, Medicaid enrollees, and prevalence rates of mental illness. Counties have strict guidelines for how they can spend their annual allocation, with approximately 75% being allocated to community services and supports, 20% to prevention and early intervention, and 5% to innovation. Of that annual allocation, counties can divert up to 20% to the prudent reserve, which is a savings account to be used during an economic downturn, or capital facilities and technology, and workforce and education and training. Counties may use 5% of their total annual MHSA revenues for the local planning process. Community Services and Supports, also known as CS&S, is the largest funding allocation for each county. Butte County achieves the goals of the CS&S component through internal programming and through contracted service providers. Full Service Partnership is programming designed for community members who encounter severe symptoms from their mental illness. This programming is highly monitored and delivers the most intensive case management services for all age groups. The majority of CS&S funding is dedicated to full service partnerships. Crisis Services was established before the MHSA, but the introduction of the MHSA allowed for expansion of crisis services, which includes our mobile crisis team, a crisis residential facility, and our Triage Connect team. Butte County has wellness and recovery centers throughout the county, which allows for peer support and socialization, along with peer-led activities and community resources. Butte County has a robust vocational rehabilitation programming, which provides supported employment, career guidance, and counseling for behavioral health clients. The supporting homelessness category is an umbrella term that covers initiatives such as 6th Street Drop-In Center for Homeless Youth, peer partnership program at the Tourist Shelter, and supportive housing programs for transition age youth, adults, and older adults. Prevention and Early Intervention, also known as PEI, aims to serve those who have yet to engage in mental health services. Service strategies in this component include prevention, early intervention, outreach for increasing recognition of early signs of mental illness, stigma and discrimination reduction, suicide prevention, access and linkage to treatment, and to improve timely access to services for underserved populations. Butte County achieves the goals of the PEI component through internal programming and through contracted service providers. Community education includes our efforts with the statewide mental health campaign and our local outreach and engagement efforts to increase awareness of mental wellness. The prevention unit works with adolescents to reduce risk factors and increase protective factors surrounding mental illness and substance abuse. Cultural outreach programs target underserved populations and work to overcome barriers to accessing treatment, including increasing awareness and addressing stigma. Early intervention programs focus on access and linkage to the appropriate level of treatment in a timely manner. At its core, an innovation project is designed to better understand how to serve unique communities. No California county is the same, and each county has different characteristics that contribute to local mental health needs. Innovation funds allow for counties to try something new in order to develop a new best practice in mental health services and supports for their communities. While each county receives an allocation of innovations each year, the Mental Health Services Oversight and Accountability Commission provides approval for spending these dollars. To learn more about current Butte County innovation projects, please visit our website. The inception of the MHSA, these two funding components were allocated one-time funding for all counties, with a 10-year timeline for spending. Butte County has used all funding in these components to address the enhancement of our workforce and the physical locations needed to provide new MHSA programming. Capital facilities and technology and workforce education and training are still a large part of the MHSA, although they do not receive annual funding. You may remember from a few slides back that up to 20% of funding can be diverted from the overall allocation, and we take advantage of this regulation to implement workforce education and training initiatives. These initiatives include dedicating funding to job-specific training, cultural trainings, and our peer specialist workforce. Every 3 years, an MHSA program and expenditure plan is developed in partnership with community members and stakeholders to analyze the mental health needs in our community and to identify and reevaluate priorities and strategies to meet those mental health needs. MHSA funds must be spent according to the plan, and there must be evidence that the community and stakeholders participated in the development of this plan. Each plan provides an overview of Butte County, MHSA initiatives, expenditure information, programs objectives and supporting data, and annual updates are required in between each 3-year plan. MHSA began with the community voice. Californians not only urged for more mental health services in local communities, but they advocated for change in the way California treated mental illness. Embedded in its regulations is the requirements for meaningful stakeholder inclusion at all levels of program planning, development, oversight, and evaluation. In Butte County, we value the voice of our clients, peers, advocates, family members, staff, and community partners. We gather feedback on all aspects of the MHSA through community input meetings, focus groups, and a specially designed survey. MHSA is a standing agenda item on the Behavioral Health Advisory Board, and MHSA reports are given at various community meetings. Butte County facilitates an MHSA steering committee which provides feedback and input on the community planning process, program evaluations, and innovative ideas. All plans and proposals are posted for a 30-day public comment period before being presented at a public hearing. Butte County has allocated resources towards thoughtfully building policies and procedures surrounding community and stakeholder engagement, and is always looking for ways to improve this process. In this slide, you will see a visual representation of the process. Broad community input is gathered and put into a report that is easy to read and understand. This report is utilized when designing the MHSA 3-year plan and its annual updates. The MHSA plans are reviewed in detail by the MHSA Steering Committee and Butte County Behavioral Health leadership. Plans must be approved by the local Behavioral Health Advisory Board prior to County Board of Supervisor approval. Thank you for your time and attention in this introduction to the MHSA. Please consider getting involved and providing input on your local MHSA initiatives. Consider sharing this presentation with individuals who would be interested in providing input on these services. If you would like to learn more about the local MHSA, you can visit the Behavioral Health website and look for the MHSA info icon. If you have any questions, suggestions, or comments, please email mhsa@buttecounty.net. Thank you.